this week's episode of the Workers' World Labour Show. I'm your host, Helga Jansen-Daubia, coming to you from our virtual studios in Khayelitsha, Cape Town. The COVID-19 pandemic has severely affected the world's people and their livelihoods. World Health Organization statistics show the first week of August having more than 18 million global infections, with more than 700,000 global deaths. Governments have responded with lockdown and restrictions in an effort to curb and control the spread of the disease. The lockdowns have shut down most of social and economic activity, with billions of people having to stay at home. South Africa is reputed to be the worst in the world for several social ills, especially violence in our society. Gender-based violence, where mainly male partners or family members attack and kill mainly female partners or female family members, is rife in our society. And we have one of the highest rates of femicide in the world. In today's show, we talk gender-based violence in the COVID pandemic and ask, what can we do about this? In today's show, we look and discuss gender-based violence in the context of the COVID-19 pandemic and ask what can be done about it. Before we go to our studio discussion, let's take a look at an insert produced by the Workers' World Media Productions editorial team.
At a time when the coronavirus pandemic has left us all feeling vulnerable and uncertain, violence is being unleashed on the women and children. The women of our country are being raped. They are being killed by men. These rapists and killers walk amongst us. They are in our communities. They are fathers, they are brothers, they are our sons and our friends. They are violent men with utterly no regard for the sanctity of human life.
South Africa, as Sonke been punting over the last few weeks, is currently at the midst of two pandemics. The one pandemic obviously being the novel COVID-19 virus, but the other and a much older pandemic is gender-based violence. So without putting numbers to it, I'll put a word to it and say gender-based violence as it stands in South Africa is a pandemic.
If you look around now, being in COVID-19, women have been locked in with the perpetrators. So for us it was lockdown, but I say women are locked in with perpetrators. So just remember, before, women were able to go and work during the day. She does not have that recourse right now. And it was difficult to get access to services, access to organizations that they would normally visit. Remember, we were isolated from families and friends, so it was a very difficult period.
The COVID-19 pandemic came at a time when Lebanon was experiencing its worst financial crisis in decades. The currency is struggling, unemployment is on the rise, and wages have been cut, in some cases up to 50%. Aid organizations say many men are bringing their frustration and anger home with them and taking it out on their wives.
In the first few years, he used to hit me in the face, in the shoulder, or stomp on my legs. Later, he beat me with sticks and iron rods, so badly that I had severe swelling and intense pain. I developed problems with my bones and joints because he always hit me in the same places. It got increasingly worse. He became more and more violent, and he knew that I could not go to my parents. Because of the nightly curfew, everyone stays at home.
I feel like when abuse happens, that they cripple you mentally, so that they make you so weak, like, because their character at that moment is so weak, so they see your dominant character, so they have to bring it to their level. And slowly, he was by piece, mentally saying, Ayla, you're not worthy, but already I'll make you worthy. I will do these things for you. I'll make you a better person because I know that's happening to you. So forgive yourself, I'm here.
Violence against women and children do not just affect the victim or the survivor. Violence against women have an impact in the community, in fact in the family first. So everybody in the family as well as the extended family. Violence against women is not a private matter.
The impact is far-reaching. The impact goes beyond even the survivor of gender-based violence, but it's far-reaching to the extent of the community. As I've said, currently we find that South African women are not free in their own country. South African women are currently sandwiched between two pandemics, you know, and that is because the one pandemic, that is gender-based violence, has permeated homes and is now into society and is wreaking havoc and fear in the hearts and mind of all South African women. So the impacts are far-reaching, and the impacts, I believe that particularly in this time, have left women with almost no place to go.
The impact is damaging. Firstly, we cannot forget that we are coming from a colonized era, and there are many effects that came out from the colonial system itself. But also family patriarchy is a problem in our society, in this country, really. It is a pandemic on its own, patriarchy as a system. The impact is huge. It's cultural, it's financial, it's social, it's even physical, you know, it's psychological as well.
When he mentally abused me, I loved him. It made me love him more, because not realizing it's so toxic. You don't even recognize when you're being mentally abused in a sense, because it's a mental, it's almost like a mental life. It's so toxic, you don't realize it's happening.
Women live in that is abuse daily. Do I go? Do I leave? Do I go? Do I leave? Do I stay for my children? So if we look at the cycle of violence, she lives almost in that cycle. She's caught up in that cycle. Her self-worth is gone. Her self-confidence is gone.
He said, it's either your career or me. And what we do as females, we love 100%. I chose him over my career. And that's when he made me, like, I was bound to him now, because I don't have a career, I don't have a job, so you're my supporter. So that's when I felt, okay, now my power is gone without me knowing, because I feel his love. He wants to take care of me, he wants to provide for me. And then when I don't make his proper food, because now we're living under my mom's roof, and then he would throw certain foods at me. So okay, fine, must be my fault because it was too warm. It didn't taste nice, so it must be my fault. I kept on blaming myself. And you said, you make me do these things.
Women feel stigmatized for reporting gender-based violence, but also women, unfortunately, even feel stigmatized and not taken seriously by law enforcement officers.
Ultimately, yet again, you're the one that must be burdened as a victim with all of this. And also, the police as well are not doing their jobs proper. And we have found that now, as the monitoring team, that the actual problem with the police is they don't even know the system itself.
It is the justice system that has failed women, and it is therefore the justice system that needs to make amends, and not women.
Women in this country have always been abused. We know this for centuries. Women globally have always been abused. As I said, abuse does not only mean rape or murder. There's so many levels of gender-based violence.
I was so scared to talk, because if I say something, I'm gonna get beaten. If I don't say something, I'm gonna get beaten. So what do? So I used to go into a panic attack. I started shaking, and then I went into full-blown seizures.
It should be a national crisis, and every department should prioritize gender-based violence as a pandemic. In fact, patriarchy. We should be working on the system to dismantle it, all of us.
Okay. Welcome back. If you've just joined us, you're watching Workers' World Labour Show, coming to you from our virtual studios in Khayelitsha. In today's show, We're talking gender-based violence in the COVID-19 pandemic. And we're joined by an esteemed panel of gender-based activists in and around the country. We're first joined by Advocate Bernadine Bacha, Director of the Sarki Bartman Center for Women and Children. Welcome, Advocate Bacha.
Well, thank you very much, Helga. Good to be here.
We're also joined by Sharon Cox, Health and Support Services Manager at the Triangle Project. Welcome, Sharon.
Thank you. Great to be with you.
We have good representation from our trade union comrades. We're joined by Shahida Manir, Regional Education and Gender Coordinator for NUMSA.
Thank you, Helga.
And certainly no stranger to the Workers' World Labour Show, the NUMSA trade union. Also no stranger to our labour show is Kusatu, Lumka Tambur, Western Cape Kusatu Gender Coordinator. Welcome, Lumka.
Thank you very much, Helga. Thank you for having me.
Women, I don't want to say ladies, women, let's get into it. We're entering 2020 Women's Month. It seems as if the gender-based pandemic is not easing up, despite the media spotlight being shed on it. Advocate Bacha, give us a sense of where we are currently in this gender-based pandemic in South Africa.
So Helga, you're exactly right. We haven't seen much of a change at all, notwithstanding the fact that we have had very many references to GBV being the shadow pandemic from our president. We've had very many media personalities speaking about GBV, but we haven't seen a change on the ground. So although, as with many things in South Africa, we have these great laws and we have a very good national strategic plan that is a great framework for dealing with GBV, the implementation is always a problem. So the numbers of women that have been and children that have been affected by GBV continue to rise, and we are not getting to alleviating the difficulties. We're not getting to eradicating GBV at all.
The numbers continue to rise, but Sharon, gender-based violence is not a problem of the heterosexual community. Gender-based violence is traversing the gender landscape. Talk to us a little bit more about that.
You're absolutely right. Gender-based violence knows no race, knows no class, and knows no identity or orientation. It is across all of those intersectionalities. And so within the LGBTIQ plus communities, we have the same struggles as the rest of our heterosexual counterparts, and that violence is a very real part of the world. And then, of course, violence perpetrated against LGBTIQ plus people on the grounds of their orientation or their identity. And that is just as the advocate was saying, that continues to grow in numbers. There is no sign of that ending anytime soon, which is a tragedy.
Shahida Manir's Regional Education and Officer and Gender Coordinator for NUMSA here in the province. Can you give us a perspective of the impact that GBV have on women and women workers in particular? And I'm asking this in the context of the police minister suggesting that men must be removed from homes. But if men have an economic contribution to make in the home, it's not so easy. Talk to us a little bit about the economic, but also, the economic and the social impact of GBV in the home and in the workplace.
Helga, you know, if we look at the system that we're in, where the economical and the political and social system, it is clear that they want us to believe that men must take the leading role. And in the industry where I come from, metal workers, it's dominated by men. Those men they are now the salary earners, the breadwinners, and so on. So the system is designed that they believe that they are the leaders, and the women stay at home, look after the children and all of those things, and they control the purse, obviously. So now you as the female, you are now dependent on this man. What happened now during, I'm now thinking about the lockdown. People were at home with their perpetrators. You were now physically there in a confined space with the person. Many of those males did not earn the normal salary. They were now waiting for the TERS money, and the frustration were then gone over to the woman that they live with or their spouse. So it is a terrible situation. It is, I think it's huger than we think, because so many women, they don't want to go and report it at police stations, because they get when you go and report, there's now a stigma attached to it. Sometimes people think that, oh, that one is being abused by a husband. And you know, in our townships, people do not understand that it is not your fault as a woman. So it's a huge problem.
Can we bring, thank you for that, but can we bring Lumka into this? And I want to talk, Lumka, in your role as gender coordinator, the issue of stigmatization. How has COSATU, in terms of their relationships with worker constituencies and the communities they come from, how have you managed to deal with the issue of stigmatization, which, as Shahida has indicated, does affect the confidence of survivors to go and report?
I think I'm muted now. I'm unmuted.
No,
can I?
Lumka, we can hear you. Please go ahead.
Thank you. Thank you, Helga, and your panelists. Nice. Like, you know, when you're talking about stigma, it's something that is affecting many women. Firstly, you know, when you go back and looking at the history of our history as South Africans, and where is this thing originating from, whereby as a woman you are expected to act in a certain way, and also looking at the social norms and the culture, the effect of the culture to us as women, because you know, the psychological part, the one thing that the patriarchal system or the capitalist system has championed was working with the psychological effect, that psychologically you as a woman, you are put in a particular corner and you are expected to behave in a certain manner. And also being married or being partnered with someone, it's something that is seen as, that is how a woman is supposed to be part of the society. So immediately when you are something else that is not required by the society, then you are no longer having that respect. So the stigma part of it, it's very huge, and it's playing a very sad part, you know, Helga, because, yes, can you hear me?
Lumka, I want to suggest, we seem to be having a gremlin in your line. I'm going to ask Sharon for you to leave the conversation and to call back in, and maybe the line will be better.
All right.
Okay?
Okay.
We're going to continue with our conversation, and I want to bring Bernadine into this. You know, Lumka talks about the changing role, the changing dimension of womanhood in South African society. Is this a contributing factor as women step up into greater economic independence and even greater political independence? Would you say this is a contributing factor to the level of viciousness of GBV in our society?
Absolutely, Helga. If you look at how GBV manifests itself, it's an act of power and control. When women are sitting, taking back their power and getting into control themselves, it's going to disturb that balance, and that disturbance of that balance is going to cause ruptures and is going to lead to higher levels of GBV. It stands to reason.
We're going to come back to this part of the conversation and bring Sharon in so that we can extend and perhaps learn more about the way in which our society is evolving, and perhaps not everybody is keeping up to date with that. To you at home, don't go away. When we come back, we'll talk more GBV and the COVID-19 pandemic. Welcome back. If you've just joined us, we're talking gender-based violence, truly a scourge in South African society. Sharon, let us bring you in here. Bernadine and Lunka before that spoke about the changing role of women in society and how this could be a contributing factor to the levels of violence, women's growing economic power and even their political power. But it's not just about women. There's also the stigma attached to being queer, being gay, being transgendered. And is that a contributor to the levels of GBV, Sharon?
Yes, it absolutely is. You know, I agree with everything that has been said around that. And when we look at the LGBTIQ plus community and violence perpetrated against people just on the basis of orientation and identity, we see that those people that challenge society's norms about what it is to be a real woman, what it is to be, and the minute you disrupt that picture in people's minds about what it is to be a woman, is when the risk of violence perpetrated, in this case, if we're talking about women, transgender women, lesbians, bisexual women, we see targeted violence towards them. The same goes for gay men. It speaks to the issue that a gay man, particularly an effeminate gay man, is not seen as masculine. So it challenges masculinities in very real ways that makes people targets of violence just based on who they are.
I see Shahida nodding her head, and Shahida, I want to bring you in here because Sharon raises the issue of people not fitting a mold of what society thinks they should be. A real man does this, a real woman is this. In the trade union movement, of course, there is a culture of patriarchy. Give us a sense of how the trade union movement is dealing with those, on the one, the changing perceptions and people stepping into who they want to be in society, and also the negative connotations attached to, you know, being a lesbian woman, being a gay man in a trade union.
Helga, I think if I look at the trade union broadly, there's more tolerance for people that's not conforming to the gender that they are assigned to. There's many challenges, obviously. You get your stones, people that think that you must be, if you're born with a penis, you are a man, and so on and so on. But I think generally it's better in trade unions than when you go into a community where people want to rape you, to say, if after I've raped you as then you will be a straight person and so on. But what you wanted to ask?
No. I wanted to just pause because you raised such an interesting dimension to this. Lunka, would it be, maybe I'm playing devil's advocate here, but the trade union movement is a disciplined environment. And so if I am a worker leader, man or woman, there are certain things that I just don't say and I just won't action in this very disciplined environment. But I am also a neighbor who leaves the shop floor, who leaves the trade union meeting. I'm also a brother, I'm also a father or a grandfather. So is there a discrepancy in what Shahida is saying between the identity of a trade union activist and that man or woman going back to the community and perhaps perpetrating these gender-based violence crimes? Lumka?
Yes, yes, Helga. You know, there's a very huge discrepancy, as we are saying it. As Shaida is saying, that the trade union is one of the environment that is very transformed. That was one of those that has made sure that we are advocating and training our members in order to be tolerant, and also, as we always say in our slogan, that we are a non-sexist organization, so you are free to be whoever you want to be. And obviously, you know, I'll always go back to this thing of capitalism. Capitalism has made sure that there's a certain way of doing things when you're in a workplace. So people start to be something different when they're in the workplace, because here, you know, this is not your own space. You have to behave in a certain manner in order for you to be able to have your bread buttered. But now there's that hypocrisy in the same people that have been trained, that the trade unions have invested a lot of monies and everything in order for them to understand how to behave in a certain environment. But now when they go to the communities, you see something different. So that is a challenge that we're facing, that you will have people that will be trained, understanding exactly what's wrong and what's right. But when they go to the communities, and I always say that the challenge is that the manner in which that our communities used to be organized before, that they were very much organized. Now we are challenged that our communities are not organized. There's this individualism understanding. And also there's also this thing that everything that is happening on your private, behind your closed door, it's private affair, so no one needs to get involved into it. That is part of patriarchy. So those social norms that are perpetrating that that individualism, and saying that you cannot get involved in what's happening at the neighbor, and what Sharon has already alluded on, that the social norms, you cannot be shaking them. And I would say many men are hypocritical again, because some of them, they want to be seen when they get into in a different environment, that as this transformed men, but yet they still want to benefit from the patriarchy that they've benefited from, and saying, because you can't be seen protecting an LGBTI person as you are a normal man, you'll be seen as weak also. So you have to act as what the community wants you to be looking like, which is wrong. So I think going back is that we need to make sure that we are organizing our communities into what exactly they're supposed to be, because that is where the problem is lying. Because when at the workplace, you know, there's a certain way that you must behave, but yet that same behavior that you trained and understanding, you don't practice it when you get to your own space. Thank you.
I want to bring Bernadine into that part, the part of the role of the community. Bernadine, the center, the Saartjie Baartman Center for Women and Children has become an important lifeline and an important point of advocacy in communities. Can you give us a sense of the role that the education of men can play in the relationship of the center with survivors who come and with the communities they come from? Because we've been talking all along about women, and women as victims, women as recovery, as people who are recovering. But there's also the man who is the perpetrator 95% of the time.
Yes, Helga, you're exactly right. So, yeah, we have to, every part of the community needs to get involved in the fight against GBV, and we're not going to be able to do it unless everybody stands up, man, woman, and everybody else. What that means is that we have to be looking, and we're not looking at this in South Africa in any concerted way. We need to start rolling out perpetrator programs to perpetrators, to start dealing with them, so that we can ensure that that the GBV doesn't perpetuate itself. We also need to be educating our boys and our young men about GBV, about healthy conflict resolution, about respect, about consent, about all of these concepts that play into GBV. So we can't eradicate GBV without men being staunch allies with us against it.
Sharon, I want to bring you in here. And, you know, we all know, as we are sitting here, the names of the survivors and the victims and their families are etched. The last 24 months have been like a pandemic itself. Sharon, can you give us a sense before we go to the break? You know, the level of inhumanity, the violence, it speaks to a deep-seated scarring in our society against the most vulnerable. I can't even begin to imagine, despite what Bernadine is saying, how we begin to challenge that level of almost lawlessness when it comes to keeping those who are most vulnerable safe.
And it's such a powerful statement and question that you pose here, because as Bernadine says, we cannot do this without men being involved in this. It shouldn't be a woman's problem to fix. And I want to add on to that about how we raise boys, particularly in the context of me speaking from victims of violence that are LGBTIQ. How we raise boys when they're young and they come home and somebody's hurt them and they're crying and they're sore, they're in pain. And a commonly heard phrase in response to that child will be, don't be a sissy, don't be a morphie, real men don't cry. So in amongst all of those, and that translates into other languages, into other ways of phrasing it, but in essence that don't be a morphie, don't be a sissy, don't be a pansy seems always to be part of the response. And so right there in the home, even if the child doesn't understand what that word means, that our child does understand that whatever it is not a good thing. And whatever it is makes the person less than.
Thank you, Sharon. We have to go to a break. When we come back, we're going to talk more about precisely that. How do we raise our boy children? Don't go away. We'll be back after these messages. Welcome back. We're talking GBV and the COVID-19 pandemic. The question I want to ask, and Sharon, before the break, you and Bernadine both spoke about the centrality of men as allies in this GBV pandemic, that we cannot do it without men. My question is going to go to Bernadine firstly, and I would like a response from all of you on this. In the last while, we know the names of the high-profile cases of infanticide, the murder of children, and femicide, the murder of women. Almost 8 times out of 10 by men who were known to them. And every time this has happened, the president, led by Cyril Ramaphosa, and the Minister of Police, Bekele, have come and made big announcements about how government's going to get involved and this fund is being established, etc. But Bernadine, it seems as if this, even GBV, is becoming a political powerhouse as we go to an election in 2021.
Absolutely, Helga. So I think I speak for all of the women on the panel today when I say we'd like to see more action and less talk. And we'd also like to see more resources being allocated to fighting GBV. It doesn't achieve anything to talk about gender-based violence. All women know about gender-based violence. We know we need to protect ourselves. We know that it's terrible out there. We feel unsafe all of the time. We need to now start putting programs in place to start addressing it. And yes, we are at the dawn of the new strategic plan, and we need to make sure that resources are ring-fenced to actually put that plan into place. There is very much work to be done, both by ourselves and by the political parties of the day, and we need to start doing that now. GBV isn't a fashion. It's not something to gain political points about. It's a pandemic that is harming and killing. It's a war against the women of our country. And we need to start grappling with that, but we need to start grappling with that systematically across all government departments. We need to start working together, and government needs to start listening to us when we say, these are the things that we need to put into place, because this is what we're seeing on grassroots level that is happening to survivors in our society.
Yeah.
Shahida, can I bring you in here? I want to get more into the how that Bernadine is talking about. There's money, and on the face of it, it seems as if there's political will. But from an organizing strategy, how would you suggest we begin to do what Bernadine is saying needs to be done?
Yeah, as Bernadine has said, time for talk. We don't have time for talk anymore. We have talked to the president. He had a summit where we gave him 24 demands that he should have implemented over a period of time, and only a few of those were implemented. If you go to a police station now, if you were raped, the chances that there will be a rape kit, it's almost zero. If you're looking for a safe house, I'm telling you, there's hardly those. And we are now tired of talking. We know there's legislation, so the responding is there, but the prevention part, that is, and I think that is where Sharon, how we raise our sons, that is part of the problem. But then the pandemic of GBV is not only in our houses. If you go like to institutions like churches, where the priests and those in position they will rather bad mouth the victim, and they will protect the perpetrators. We have the case of the Reverend June currently here, who had a hunger strike recently, and the help that she's getting from the church. So if we don't do the things that the president promised us he will do, like having the register for the rapists, so that we can see who they are when we call an interview for a vacant position, that you can go and look and see this person is a rapist, we cannot employ him. So that is the type of things that we must start looking at if we want to go somewhere to fight the pandemic of GBV.
Lunka, the issue of a registry, of beginning to concretize all these, as Bernadine is saying, these paper tigers, because right now they're paper tigers. They don't have much bite unless we give them the bite. How would you approach the issue of, for example, making sure that there are police stations that have a safe room, that police training is done? We know that this has been spoken about, all the time. But is there a way that we can make sure that every station commander sends their staff for training, etc.? Lunka?
Helga, you know, when we're talking about gender-based violence, it makes my boss bend. You know, as we're talking now, all of these women that are sitting here, if you can go back and do a stock taking of how long have you been marching, how long have you been picketing, how long have you been going to these police stations, how long have you met with the commissioners, met with the minister of police from the first ones and all of that. And in paper, we will get all of these things that these people are being trained. And as you have alluded before to say that the president will come out and he'll say all these beautiful words, very beautiful. And now we are in the dawn of the National Strategic Plan that has been endorsed. We're busy with training. I just attended now another one, like unpacking all these pillars. But we will go trying to answer your question. How are we going to make sure? We've been trying to do that, but we've even went to a point that we volunteered ourselves. Many gender activists have volunteered themselves that they were going to be making sure each each and every, on weekends especially, we will go to, and is there a police station, that is there, all the things are there, but there's still very limited of them that are having these rape kits. So to me, I will say, Helga, this is a structural or kind of systematical gender-based violence by government to its own people, because you cannot keep on saying you are trying to fix an entrenched problem with coming up with different forms, because each and every time there will be a different form that is developed, but it's not changing the root cause of this pandemic that we are faced with. We're still having, for instance, taking to the part of the children. How are we going to raise children properly when women are still earning less, when women are still staying far from their workplaces, when women are still having to depend on these men, and government is not doing anything about that? It's not changing the issues to make sure that we are developing women to be able to be independent. So the only thing that I will say, Nahalka, that is going to assist us, this is a struggle. We are in a struggle, and I don't know who else wants to see something different. This is a war that we're in. And men will make anything to make sure that they keep their power. So if we don't come up with a revolution in order to change this current conjuncture that we are faced with, we're not going to do anything. We cannot think that we can fight men that are very adamant in not changing the current status quo that they are benefiting from, and think we are going to fight them with petitions. If we don't, because if you can go back, sorry.
I want to bring Sharon in here, because you frame it as a war. I'm talking about a pandemic and you're saying a war. But Sharon, there are different battles to be fought in this war, if you want to continue the war analogy. I want to ask, and I want to ask because I genuinely don't know, rape kits, are they geared to make sure that they can assist all victims of rape and not only women? I ask this in the context of, in the last while, there have actually been very brave young people, young men, who have stood up and said, I was raped. Is there a mechanism to encourage and to strengthen their ability to come out and to lay charges? Sharon?
I'm so glad you asked that question. Yes, it is a war, and the war is predominantly on women's bodies. But I think a very invisible or nearly invisible part of it is that boys and men are raped too. And that struggle is decades behind this struggle. And while this struggle needs all the attention, all the focus, the resources, we've had enough of talking, we've had enough of marching, we also need to consider this. And I'll just give you one case very quickly of how inadequate the system is at dealing with male rape victims. So firstly, in order to report, if you think women have a hard time, and they do, I'm not saying for 1 minute they don't, we must understand that it is really difficult for men to report because of all that stuff around masculinities. How do men get raped? Why do we know all of that? But I want to give you a real case when you ask about rape kits. Yes, rape kits are rape kits, but a male presenting at a hospital, and I want to really emphasize rural here, because we always have information, education, the limited resources that we have, but it's concentrated around urban and peri-urban. The minute we move to rural, you're buggered. You know, there's so little of anything in the way of support there. And so you have a male raped, taken to the hospital, seen by the doctor, and now a doctor is examining an anus and not a vagina, as if, you know, women aren't raped in multiple ways. But all of a sudden, this seems to place some barrier between the victim and the medical practitioner. So you have a very poor rape kit done, a very incomplete J88 done, a very, very poor testimony in court presented as doctors present as expert witnesses, because somehow it's almost an untouchable area. And I think this also speaks to the training that our young people get, or the lack of training our young people get around rape kits generally. I think the most that anybody gets in a university setting is 2 hours, and most students, medical students, have not even seen a real rape kit. They've only seen YouTube videos of it. And that for me is very frightening, because how then do we have proper things done?
Thank you, Sharon, for that, that very, very important point. We'll be back after these messages when we go into our final segment. Welcome back if you've just joined us. I want to just come in, Advocate Bernadine. During the lockdown, you know, there's a lot of restrictions on the civil freedoms of South Africa right now. Alcohol being one of the biggest. And we saw when the ban was temporarily lifted, there was a spike in GBV cases. Is this something that we need to interrogate as a society, the link between alcohol abuse and gender-based violence? Bernadine?
Absolutely, Helga. So just to put it in context, when South Africa went into lockdown level 5, as shelters in the Western Cape, we were waiting for this huge increase in cases of women that wanted to come into shelters, because we'd been looking at what had been happening overseas. So China saw a 30% increase in the numbers, in the rates of GBV. There was an increase of 33% in France, and we were ready for this huge surge in numbers of women wanting to access services, and it didn't happen. There are very many reasons why that didn't happen, and we're still interrogating those. But what's pertinent for your question is that directly after the alcohol ban was lifted, it took about 2 days, and all of the first aid shelters in the Western Cape were full. You could see immediately the effect of the lifting on the ban of alcohol sales on GBV rates. It was something to see. So yes, we should be interrogating responsible drinking. We should be looking at how drinking is. It definitely contributes to GBV. At the Saki Bartman Center, we have a substance abuse unit for exactly that reason, because substance abuse and gender-based violence are interlinked. You very seldom will find one without the other.
Exactly. Luca, maybe we can bring in here abuse of alcohol, and not just abuse, but the relationship which South Africans seem to have with alcohol consumption. Do you think that this is the moment when we as a society begin to interrogate and maybe call for more public education, for more public health education on alcohol, in an effort, because of course we can't remove alcohol from our economy completely, because there's also an economic dimension to it. Do you think that we need greater education in our society? Lumka, are you there? Okay. Shaida, as Sharon, our producer, tries to get Lumka back, can I take the question to you? Do you think that we require more public health and public education on alcohol in our society?
Yes, we need a lot of education, because, you know, there's this difference. No, I'm here. Yes, I'm here.
Okay, Lumka, okay. We'll take it back to Lumka then. Sorry, Shaida, we'll come back to you. Lumka, continue. And now we seem to have lost her. I'm sorry to do the Shaida. Maybe we can go back to you.
Yeah, I think, Helga, many of us, we do believe that definitely with the alcohol ban, there was an improvement, there was lesser cases, but it's still up to us as a society. So from trade unions to churches to universities, wherever, I think it would be good if we take up a campaign where we I don't know if we can still educate people on responsible drinking. I think every citizen should know that this is my limit. After this, I will misbehave. Whether our efforts to train and educate people on how to drink responsibly, whether that would help. If it can help, surely we must then put that campaign ahead and try to do something. But my own feeling here is you can educate, you can do, you can go and sing, you can go and strike, you can go and picket. But if a person want to abuse alcohol, he or she will continue to do so, irrespective of what the consequences of his or her abuse will be.
Absolutely. Bernadine, I want to bring you in here now. I want to just talk about, we've spoken about alcohol, and we know that there's a systemic and historical relationship between South African society and alcohol, and this is historical from the drop system, etc. But I want to now just talk about legal stuff. In the last while, you know, there have been reports, despite the president's overtures to the Justice Department to strengthen conviction rates. There have been magistrates at court that have given really lenient bail conditions despite the moment that we are in. What do you think the reason is for that?
So when it comes down to reason, I think that there's a lack of understanding, and I don't know how that could ever be possible when we have been fighting this pandemic for decades, as to as to how the criminal justice system can itself begin to fight GBV. So the criminal justice system as a whole needs to be overhauled. When it comes down to it, the police need training. They can tell us they have training as much as they want to. I can tell you I had an incident over the weekend where it was clear that there wasn't, that the police officer involved wasn't trained. We need to be looking at our domestic violence courts and the fact that women during the lockdown are being turned away, which is unconscionable, which led to the very sad demise of Altisha Corky and her daughter. We need to be looking at sentencing. We need to be looking at the provision of bail for perpetrators, because a lot of time these people that perpetrate violence against women are on bail and already known to the criminal justice system. So the criminal justice system as a whole, from judges all the way down to police officers, needs to be re-looked at, reworked. We need to be making sure that there is an emphasis on GBV and GBV sensitive justice going forward.
Sharon, to bring you in here, the domestic violence courts, there was once again a lot of media attention when the president launched these courts, etc. I would like to ask if the constituency that you work with, have these courts been readily accessible for them and to them to report and to legislate, to engage with their perpetrators in the domestic violence courts? Because, and I'm asking this precisely because Bernadine is saying that clearly that more training needs to happen for magistrates.
A lot more training needs to be happening with magistrates, and much less flexibility in the interpretation of how they hand down sentences and also give out bail. Insofar as domestic violence and access to courts, LGBTI people are still highly reluctant to report these cases because we know what police's response is often when a person would go to report an incident of domestic violence, and say for instance it's a lesbian couple and so your perpetrator is female, and there's all this disbelief that a female could actually do this to another female, as if this doesn't happen amongst women too. Or the same with a man, well, you're a man, why didn't you turn around? You know, all those kind of very stereotypical responses that you would get from people in perceived power because of stereotypes. So the knock-on effect of that is very few people actually do report cases of domestic violence to police officers. they would come to somebody like us or to Saki Bartman Center. We would call on Saki Bartman Center, for example, because they're one of the few shelters too that will take in transgender women. And so we use other avenues, but still we have a great reluctance on the part of LGBTI people even to report these cases, never mind them going to court.
Okay, we're going to start wrapping up now, and this is such an unfair question that I'm not even going to ask it because you've answered it in more than one way. But this pandemic is going to be with us for a very, very long time, even when we have vanquished the COVID-19 pandemic. So I guess the question that I have is, what is the next step in your activism? And you've both alluded to, all of you have alluded to the fact that our legislation is probably some of the best in the world. I'm going to start with Lumka, and we don't have much time, so I'm going to ask you to keep it short. What is your next step as COSATU?
Our next step it's now as we need to focus in making sure that we are training men. We've started with the campaign of male gender champions, because obviously now there's this unbalanced equation that we're having well-trained women that understand these laws and what is not supposed to happen in terms of gender-based violence. But now we keep on preaching to the converted. So now we're trying to bring men in to make sure that they understand the depth and what's not to be done in terms of gender-based violence, and how do they fix their own ways, and what are their own challenges that they are facing in terms of gender-based violence, how they can be assisted in also to make sure that we are curbing the scourge.
Shahida, NUMSA, what is the next step for NUMSA in the GBV pandemic?
So NUMSA will be having some event on Monday. That is now the NUMSA one. We also trying to invite men to our gender structure. Some of the men, they will come, but the ugly patriarchal head will show in that meeting because they want to take over and so on. But we do, as a union, we do invite males to our structures, and we also what we try to do is to weave the gender part of the organization into the main structures of the union, so that there's an equal balance of things in the union.
Bernadine and Sharon, my quick question to both of you is, as GBV activists, is how are we going to manage the fact that we had all this legislation out there? What is the next step in dealing with the pandemic, I suppose, from a legislative and a practical point of view? Bernadine? Bernadine's mic seems to be muted. Sharon? Sharon, can I get you?
Yeah. Well, it's a never-ending struggle, isn't there? There's a legal framework in place, but I want to go back to what Bernadine, I think, was saying, and all the other speakers have said, that government have got to stop talking about it, because that can't be perceived as political will. There needs to be resources placed where resources are needed, and that's on the ground with grassroots organizations and activists that are doing the work. And there's no more time for talking, and there's also no more time for elaborate plans and frameworks that actually don't translate into reality for survivors of gender-based violence.
Thank you, Sharon. And the last word from the Saki Bartman Center for Women of Color, perhaps fittingly so. Bernadine, the role that the center will play in the broader societal campaign.
So Helga, we've always had a very robust advocacy and lobbying platform at the centre, and we'll carry on doing that. We'll make sure that government sticks to its obligations in terms of rolling out this national strategic plan and making sure that it gets into effect as soon as possible. But over and above that, we're very focused on the economic empowerment of women, because until such time as women are economically empowered, we're not going to be able to deal with this pandemic effectively. So we're looking at a job center at the SARC Department Center. We're also looking at housing for women once they exit shelters, because if she doesn't have that, she's going to go back to the perpetrator. So we need to empower women holistically is what I want to say.
Thank you very much for that. Indeed, we want the empowerment of women and men in a holistic way, and in a way in which all partners in society work together. Thank you so much to our esteemed panel, Bernadine Bacha, Lumka Tambour, Sharon Koch, Shahida Maniz. Thank you to all of you, and to you at home till we see you from the Labour Show. Till next time. Good night. Thank you, everybody. That was a fantastic show. Thank you. I trust that you and your organizations are going to have a robust Women's Month, and that your plans and your agitation and your making all the good trouble will bear much fruit. So thank you to all of you from Women's Month.